Imagine a tiny mass no bigger than a grain of sand, capable of wreaking havoc in your body. That's a blood clot for you. Let's delve deeper into what exactly a blood clot is. Picture a clump of blood cells bunched together like a tiny army. Its primary mission? To stop bleeding when you get an injury. It's a crucial part of your body's defense mechanism, a soldier in your body's healing process. But like any good story, there's a twist. These little heroes can turn into villains. And that's where the danger lies. When these clots form inside your blood vessels, not on the surface of a wound, they become a hidden threat. Picture this. Your blood vessels are like busy highways, ferrying life-giving blood to every corner of your body. Now imagine what happens when there's a roadblock. Traffic grinds to a halt, right? It's the same with a blood clot in your vessel. It blocks the smooth flow of blood, causing a traffic jam in your circulatory system. And it's not just a minor inconvenience. This blockage can lead to serious complications. It's like a ticking time bomb waiting to explode. It can cause a stroke if it blocks a blood vessel in your brain, or a heart attack if it blocks a vessel in your heart. And if it travels to your lungs, it can even cause a potentially fatal condition called a pulmonary embolism. But let's not get carried away by the doom and gloom. It's important to remember that blood clots play an essential role in our body's healing process. It's only when they form in places they shouldn't do they become a threat. So, a blood clot can be both a lifesaver and a lethal threat, depending on where it forms. Blood clots are not exclusive to any part of the body. They can occur anywhere, turning your body into an unseen battlefield. When we think of battlefields, we often imagine vast landscapes marked by chaos and destruction. But there's another battlefield, one that's invisible to the naked eye, yet just as chaotic and potentially destructive. This is the battlefield within our bodies, where blood clots can form and wage war on our health. Blood clots can occur in various parts of the body, each bringing about different outcomes based on their location. Picture a clot forming in the veins of your legs. This is known as deep vein thrombosis, a condition that can cause pain and swelling, but can also be silent until the clot dislodges and travels to the lungs, leading to a potentially fatal pulmonary embolism. Now imagine a clot within the arteries of your heart. This could result in a heart attack, a situation where parts of the heart muscle are deprived of oxygen, causing chest pain, shortness of breath, and potentially sudden death. Let's not forget the brain. A blood clot in one of the arteries leading to the brain can cause a stroke, a condition that can lead to paralysis, difficulty speaking, and numerous other long-term disabilities. But it's not all doom and gloom. Our bodies have remarkable self-healing abilities, and in many cases, they can dissolve these clots before they cause harm. However, when this process fails, or when the clots form in significant volumes, that's when we encounter problems. The formation of blood clots is a silent process, often revealing itself only when complications arise. It's like a covert operation happening inside our bodies, hidden from our senses. But just because we can't see it doesn't mean we can't fight it. In the scenes to follow, we will delve into the triggers, preventive measures and treatments that can help us win this unseen war against blood clots. What makes us susceptible to these dangerous clots? Certain factors increase our risk. It's a question of triggers, of those elements in our life that can make us more vulnerable to the formation of blood clots. Let's delve into some of these risk factors. Firstly, we have family history. Like a map of our past, our genes can often predict our future health. If blood clots are part of your family's medical history, your risk may be higher. Next, we have inherited conditions. Some of us are born with a predisposition to clotting, a genetic wildcard that increases our risk. Then there's obesity. Excess weight puts extra pressure on our veins, particularly those in our legs and pelvis. This can lead to blood clots. Likewise, smoking can play a role. It's a habit that damages our blood vessels and affects the flow of blood, creating an environment where clots are more likely to form. Stress too is a trigger. When we're under stress, our body produces hormones that increase our blood's ability to clot. Lastly, certain medications can increase our risk. Some drugs, including hormonal birth control or hormone replacement therapy, can thicken our blood and make clots more likely. Yet it's not just about knowing the risk factors. It's about understanding them, about recognizing them in our lives, and taking steps to mitigate their impact. It's about making wise choices for our health. Choices like maintaining a healthy weight, quitting smoking, and managing stress effectively. These triggers are not a guarantee of blood clots, but rather a warning. They're a sign that we need to take our health into our own hands to make the necessary changes to protect ourselves. Knowing your risk factors is the first step towards prevention. Let's not stop there. Let's use this knowledge to fuel our fight against blood clots, to arm ourselves with the best defenses possible. Stay tuned as we unveil the shield of prevention in our next segment. Prevention is always better than cure, especially when it comes to blood clots. As we journey deeper into the realm of prevention, let's shed light on several strategies that can be employed to keep blood clots at bay. First up, regular exercise. You see, when you stay active, your blood circulates more efficiently, reducing the chance of clotting. Whether it's a brisk walk, yoga, or a quick sprint, any form of exercise contributes to the smooth flow of blood. Next, we have a balanced diet. A diet rich in fruits, vegetables, lean proteins, and whole grains not only keeps you healthy, but can also help prevent blood clots. Foods high in vitamin E and omega-3 fatty acids in particular are known to prevent blood platelets from sticking together. Hydration also plays a crucial role. Water keeps your blood from thickening, which can lead to clotting. So remember to drink up and keep your body well hydrated. Maintaining a healthy weight is another preventive measure. Excess weight can put pressure on your veins, leading to blood clots. By keeping your weight in check, you can reduce the risk of clot formation. Smoking, as we all know, is a major health hazard. It accelerates clot formation by thickening your blood and increasing the likelihood of plaque buildup in arteries. Quitting smoking, therefore, is a powerful step towards prevention. Stress management is also key. High stress levels can lead to changes in blood pressure and clotting. Practicing mindfulness, yoga, or other relaxation techniques can keep stress at bay and your blood flowing smoothly. Lastly, wearing compression stockings, especially during long periods of immobility like on a flight, can help prevent blood clots. These stockings apply gentle pressure to your lower legs, helping blood flow back towards your heart. Each of these measures is a vital piece of the prevention puzzle. By incorporating them into your lifestyle, you're building a robust shield against the threat of blood clots. So, remember, these preventive measures are your shield against the threat of blood clots. For some, a shield may not be enough. They require an additional layer of protection. This brings us to the topic of blood-thinning medications, an extra fortress for those walking a higher risk path. Blood-thinning medications, also known as anticoagulants, perform a remarkable role in our bodies. They don't actually thin the blood, contrary to what the name suggests. Rather, they decrease the blood's ability to clot. This reduction in clotting ability can be instrumental in preventing harmful clots that might otherwise block blood vessels. Let's dive a little deeper into how these medications work. Picture a bustling city, with the blood vessels as the roads and the blood cells as the vehicles. Just as traffic rules keep the city running smoothly, our bodies have a complex system to maintain the flow of blood. When a blood vessel is injured, the body responds by forming a clot to stop the bleeding. However, sometimes this system can go awry, forming clots where they aren't needed. It's like a traffic jam on a busy road, blocking the flow and causing complications. This is where blood-thinning medications come into play, acting like a traffic controller, ensuring that clots are only formed when necessary. These medications are usually prescribed to individuals who are at a higher risk of developing blood clots. This includes people with certain heart or blood vessel conditions, those who have undergone surgery, or those who are bedridden. The medications help to prevent stroke, heart attack, deep vein thrombosis, and other serious conditions. It's important to note that while these medications can be life-saving, they must be used under the guidance of a healthcare provider. They can have side effects and their use needs to be carefully monitored. Remember, these are not a substitute for lifestyle modifications, but an added measure for those at higher risk. Blood-thinning medications offer an extra layer of protection for those at higher risk. They're like the knights in shining armor, keeping the fortress of our bodies safe from the potential onslaught of rogue blood clots. Preventing blood clots is not a one-size-fits-all approach. It requires individual assessment. This is a fact we cannot stress enough. Each of us has a unique blueprint, a distinct set of circumstances and unique health factors that play pivotal roles in our susceptibility to blood clots. The importance of consulting with a healthcare provider to assess your individual risk and develop a prevention plan cannot be overstated. This consultation is more than just a casual chat. It's a comprehensive examination of your lifestyle, your medical history, and your present health conditions. It's about peeling back the layers, delving into your family health history, and considering any inherited conditions that may increase your risk. Your healthcare provider will also take a closer look at your current lifestyle choices. Are you a smoker? Do you lead a sedentary lifestyle? Are you under a lot of stress? These are just some of the questions that will be asked during the consultation. Your medications will also come under the scanner. Certain drugs can increase the risk of blood clots, and your healthcare provider will assess if you are on any of these, and if so, whether alternatives can be considered. The consultation also involves a thorough discussion about preventive measures. Regular exercise, a balanced diet, hydration, maintaining a healthy weight, quitting smoking, stress management. These are not just generic recommendations, but key components of your personal defense strategy against blood clots. Your healthcare provider will help you understand how each of these elements can be incorporated into your daily routine in a way that suits you best. For those at a higher risk, the consultation may also involve a discussion about blood-thinning medications. These medications can play a crucial role in preventing blood clots, but they must be prescribed and monitored by a healthcare provider. Remember, this consultation is not a one-off event. It's an ongoing process, a journey you undertake with your healthcare provider to continually assess and manage your risk factors. A tailored prevention plan is your best defense against blood clots. So let's take the first step. Let's start the conversation. Let's make consultation a key part of our strategy against blood clots. Because when it comes to our health, every decision matters. Scene script. Let's address some common queries about blood clots. First off, a question we often hear is, what exactly is a blood clot? In simple terms, it's a clump of blood cells that forms to stop bleeding when we're injured. It's a crucial part of our body's defense mechanism. However, these clots can turn into a double-edged sword when they form inside our blood vessels, blocking blood flow and leading to serious complications. Another common question is, who is at risk? While anyone can get a blood clot, certain factors increase the odds. These include a family history of clots, inherited conditions, obesity, smoking, high stress levels, and certain medications. If you identify with any of these risk factors, it's crucial to consult with a healthcare provider to assess your individual risk and develop a prevention plan. So, how can one prevent blood clots? Lifestyle changes are your first line of defense. Regular exercise, a balanced diet, staying hydrated, maintaining a healthy weight, quitting smoking, and managing stress can all contribute to reducing your risk. Additionally, wearing compression stockings can help prevent clots, especially if you're at a higher risk. Now, what about medications? Yes, for those at a higher risk, blood-thinning medications may be prescribed, but remember, these should be taken under the guidance of a healthcare professional to avoid potential side effects. Another question that crops up is, do blood clots always show symptoms? Not necessarily. Blood clots can be silent saboteurs. That's why it's so important to be aware of your risk factors and take preventive measures. The final question for today, can blood clots be treated? Absolutely. Depending on the location and severity of the clot, treatments can range from medications to dissolve the clot to surgical procedures in more severe cases. But remember, prevention is always better than cure. Knowledge is the most powerful tool in preventing blood clots. Stay informed, stay safe.